Those are the ways that, those are the vehicles for them to get covered. How are we going to pay for it? So that how much money is coming out of your pocket, how much money is coming from the government, and what other sources of funding. Now, about a half of the cost, somewhere between $400 and $500 billion, is coming from a reorganizing of how we pay in Medicare. So remember I was saying about the hospital discharges? Well, they think they're going to make a fair bit of money by penalizing hospitals, that is not paying hospitals for that readmission. They're not paying them. So there's a lot of provisions that are in there that saves them money on Medicare. They're no longer going to pay the bonus to managed care companies that cover people on Medicare, the Medicare Advantage. Those are just HMOs that cover people on Medicare. They're no longer, they get a bonus payment for doing that. They're no longer going to get that. That's going to save them another couple $100 billion. So they're looking at fixes to Medicare that will save the government money. Yeah.
That last thing you said, that's not going to stop people from just taking Medicare? Like, won't that just stop services?
No, it's right now, you either can be in traditional Medicare, which is you turn 65, you get like a Blue Cross, just like you would get like a Blue Cross plan. You get Medicare. You can go to any hospital that accepts Medicare, they all do. Any physician that accepts Medicare, 99.9% of them do. And they, as long as they're taking Medicare patients, you just operate in that way.
But
First
if they're taking away that bonus, don't you think providers and hospitals will start not taking Medicare?
Well, the managed care plans will not want to enroll. That's right.
So
they're not saving us any money right now. It actually costs Medicare more money to be in an HMO. And the outcomes aren't that much better. I mean, they're indifferent.
you don't think it would be an issue with lack of access to care?
Mm-hmm. Not at all. Yeah, do you have any?
I guess it's a similar question. What are the, is it going to lead to a reduction in services for the Medicare beneficiaries?
The one thing is that traditional Medicare has a set of benefits that it pays for. If you want something above and beyond that, for example, one of the very interesting things is Medicare does not pay for hearing aids. Right? When do you think you need one? They don't pay for some durable medical equipment. One of the things is hearing aids. People buy supplemental insurance policies to cover some of those things. Also, prior to them passing Part D Medicare for pharmaceuticals, they would get a supplemental plan to help them pay for drugs. They don't have to do that as much now because they're getting it through Part D. So some people who are on Medicare Advantage, one of the reasons they're more costly is because Medicare Advantage offered them some of these additional services, which Medicare normally does not pay for. So we're paying them to provide things that general Medicare doesn't get. Well, do you want it to come out of your tax dollar, or do you want it to come out of pocket? So some people will, as a result of that, if they're dropped from their Medicare Advantage plan, will no longer get the additional benefits that Medicare does not pay for, that they were getting through this. And if they want to continue to have it, that would have to come out of their pocket. That's right. So there's about somewhere around 20% of people in Medicare are currently in a Medicare Advantage plan. And, sorry?
Isn't that a really big issue that we're losing these care?
Well, they're losing the additional benefits. What that would mean is that the 80% of people who are in Medicare are horribly underserved because they're not getting these services. I mean, they pay for most things. I mean, they don't pay for some forms of DME. But it's either coming out of their pockets, it's coming out of our pockets, it's coming out of somewhere. And so that's one of the places where we're simply going to have to pay more in this. And it's how do you best share that burden. And part of what they also are doing, though, to give back to people on Medicare is some of that money that's being saved from doing that is going back into the Medicare program. Not all of it's going to pay for health reform. Some of it's going back into the Medicare program, particularly around Part D benefits. You've heard of the donut hole? Do you know what it is? Okay. So it's going to fill in the donut hole. So they're using that because that's one of the biggest out-of-pockets. And that has been an area of concern. So some of that money's going in to fill the donut hole. Yeah.
This is where I would love to trust that all the money would work out and all the savings would come from one place and we'd be able to move it around. I just don't trust that's going to happen. I mean, how do you...
It's, a lot of it does, it moves generally in that direction, but it's kind of like your own budget. In January you start out, and then who knew that course was suddenly going to have, two $250 books you have to buy, and so you're making adjustments as you're going along.
Yeah, go to financial aid and get more money.
And so they estimate the best that they can. I mean, even these scores, like how much money and what's it going to take, is based on our current prevailing knowledge of how much these things cost. You may have heard that part of the debate on the Hill, part of the argument about these scores that come out, have been around, well, they're not scoring prevention as saving any money. That's right. We have no research evidence that demonstrates thoroughly that getting good preventive care saves money in the long run. It may. Right? We just don't have any numbers. Nobody sat down and tracked that. So you take it to the Congressional Budget Office, and they're supposed to say, well, how much do you save from that? What do you think they do? They go to the same literature you look at. They look at this information, and they say, maybe it does, but we don't have any evidence that it does. So if it does, maybe we actually come out better. If it actually costs more than what we know now, it raises the bill. So there's a lot of plunging in that. Yeah. So I'm sorry, what?
Have they compared other countries on how they do it? Where they focus more on preventive care?
They have looked at that. It's like, oh my God, it's another country. No, we do things uniquely American. So they're loath to look at other countries. But they have looked at that. In other countries, this is another myth, like other countries pay a lot more in taxes than we do. If you add up what we pay in taxes and what you pay in your premiums for health care, we pay more than any other country. Right? It's just not a tax. So it's technically true. So they have looked at other countries as to their access and what their outcomes are. And in fact, the World Health Report that came out, it's now probably about 4 or 5 years ago, ranked the United States 37th in the world on overall health outcomes. So that on many other things, our health outcomes are much worse. And that is, those are facts that people know, but the ones that get the most airtime are ones that don't sell that message. It's death panels, we're going to kill Granny with this, and all of these sorts of things are the ones that are getting the airtime. Socialized medicine. It really amazes me that term, 60 years later, is still being used. Although, I think the wall came down, but, somehow they haven't figured this out. So the messages that are out there are bad. But there are a number of other countries that have invested in that way and do much better.